Good evening, I'm Bruce Haynes with PBS 39 Public Television. Welcome to H1N1 Community on Alert, a program produced in partnership between the Fort Wayne Allen County Department of Health and all 4 Fort Wayne area television stations. During this important hour, you'll hear from experts who will be addressing various aspects about H1N1 flu virus, including the symptoms, the vaccine availability, work and school issues, and the important question of when to stay home. During the hour, you'll also be able to call in your questions to health professionals who are seated at a phone bank behind me. The number is on the screen, 969-2721. You'll also be able to email questions to flu@allencountyhealth.com. This live broadcast is airing simultaneously on WFWA PBS 39, Wayne TV News Channel 15, Indiana's News Center stations 21 Alive and Wise 33, Fox 55, and Access 1 on Comcast 55, and also on Verizon 25. The program is even being shown at a variety of sites around the Fort Wayne area where language interpreters are helping to share the information that's being presented. Through it all, the goal of this coordinated community outreach is to prepare us to know how to respond to the H1N1 flu during the upcoming flu season. And we thank you very much for tuning in. So let's begin by introducing Dr. Deborah McMahon, Allen County Health Commissioner. She's with News Channel 15's Heather Herron.
Well, thank you very much, Bruce. As you said, this is a very important issue. So important, in fact, that we all decided, we, TV stations, media outlets all across the city, that this was something worthy of bringing to you, the viewer. Deb McMahon, as you just heard, is the health commissioner locally. And we have heard a lot about pandemics and the fear that this H1N1 could become a pandemic. What is that exactly?
Well, a pandemic is really a global outbreak of influenza. It's a novel influenza, so that means a lot of widespread transmission. And we know that the first characteristic, like I said, is that it's a novel influenza virus, which means lots of people can be infected because there's no immunity to it. The second one is that most of these diseases originate in animal populations, but so it has to be able to not only infect human beings, but make them sick as well. And then the last one is that it actually has to have sustained transmission in a community. And that's what we're seeing. And on June 11th, the World Health Organization declared the current H1N1 to be an influenza pandemic.
Well, as many as 3,500 people worldwide have come down with, I should say, have died from H1N1. So it is nothing to mess with.
No.
We have had 4 people here in Indiana, and two of them, a brother and sister in the same family. So our Alyssa Ivinson takes a look at how it affected that family.
Katrina McIntosh waits for the rain to hear from her Matt and Mindy.
Every time it storms, we hear those drums.
Matt, a drummer.
He'd pat his chest all the time, drum on his chest if he didn't have a drum or something to hit. He had his belly.
Friends called him Skinny, the star of his own band.
He was a rock star. He always knew he'd be famous.
Mindy, a jokester.
Always making their friends laugh, making us laugh.
She was going back to school for accounting.
She's so smart and bright.
Both victims of the H1N1 flu virus.
We cannot figure out where they got it.
Katrina had heard about the H1N1 virus on the news, but never thought it would hit so close to home.
I try to remember the good times and not the bad times. I try not to think of the hospital.
Wednesday, June 24th. Matt woke up with a fever. 2 days later, his older sister Mindy and their dad Mark got sick too. Mark got better in a few days, but Matt and Mindy got worse. Both went to the hospital. Just 19 years old, Matt died 11 days after his first symptoms. Mindy, 26 years old, died 3 weeks later.
They were both healthy. We don't know why it hit them so hard.
Health officials say most severe H1N1 cases are in people with other medical conditions, but a third happen in seemingly healthy people, many young adults like Matt and Mindy.
There are going to be some people that should have a very uncomplicated course and won't, and that makes it very difficult.
And unimaginable for a mother who lost both her children in a matter of weeks.
There are days when I think, I gotta tell Mindy.
But the spirits of a drummer and a jokester will live on with every storm and gentle breeze.
So every time I hear it ring, I think of her.
As the McIntosh family figures out how to live with a new normal. In Dearborn County, Alyssa Ivinson, News Channel 15.
I think what is so concerning, what's so upsetting about a story like that is that they were seemingly healthy, very young, active people who contracted a virus that we never think of as being fatal, but in this case was.
What I found is that for parents, when children die of infectious diseases, it's like nothing else, because we're so used to being able to people being treated with an antibiotic. We're used to seeing older people die of complications of infection, but when it happens to our children, that has a whole different feel. It has a whole different impact on a family and a community if it happens in large numbers.
Who is most at risk of getting the virus and then of dying from it?
Well, Tom is going to talk a little bit about that in our next segment, but what we know with this particular virus is that it does tend to impact younger people. For some reason, we think that older people, maybe because they were born at a time when before 1957 and there were some circulating viruses, and maybe there's some cross-reactivity with that, but we know that older people born before 1957 don't have the infection rates that we see with young people. We also know that people who have underlying health conditions are more at risk for complications. People with asthma, lung disease, diabetes, those types of things, those people are more at risk, the very young, the very old, more at risk for complications.
We've had a lot of people in the United States get sick from it and die, but it started in other countries. Talk about how that has transmitted, has made its way to the U.S.
Well, I think it's so interesting because if you recall years ago we talked about bird flu. Everyone was so concerned about avian flu, and we followed that for many, many years, but it was never able to make that jump to where it could easily spread from person to person. But last March, H1N1, it was initially called swine flu, actually presented in Mexico, and the stories we were hearing were, oh my gosh, that thousands of people were being infected, hundreds of people were dying from that. And it wasn't but a few weeks later that we started seeing cases in the United States. And I think a lot of transmission occurred after that. We started seeing that a lot of schools were affected at the time, if you recall, in New York and all of that. But what we found was that on June 11th, the World Health Organization determined this virus has met all of those requirements to be a pandemic virus, and in fact is seeing sustained transmission. And since that time, the World Health Organization has been following that in the southern hemisphere. And again, this virus is the dominant virus. It's the primary influenza virus globally right now. And again, most people do not have any immunity to it.
And when we see those types of pandemics move through the country, are there origins, places it starts in the country, or will we just see it pop up in various sectors of the country?
Well, the Centers for Disease Control have a great website where they monitor influenza activity via what they call sentinel sites, and we have 5 here in Allen County. And what they do is they collect specimens, send them to the CDC, and they determine what are the circulating strains. And this system has been in place for years. And if you go to their website, as of right now, virtually everything circulating in the United States is H1N1. So again, it is the dominant virus out there right now. And remember, most people will not have any immunity to this. So that's why we'll see potentially large numbers of people become ill.
And hearing that word pandemic often scares people.
Well, I think most people, when they think of pandemic, they think of 1918 and they think of the Spanish flu. And, you know, that was where 50 to 100 million people died of pandemic flu, more than all the people that have died of AIDS since it was first identified in the 80s. So it was reason to be fearful. On the other hand, we've seen pandemics with the Hong Kong flu, the Asian flu, where we've had, 70,000 people die from influenza. So again, there's a great deal of variability. The problem is with pandemic viruses, we know they make a couple passes around the globe. So, and the first pass is usually mild. So that's why everyone, including the World Health Organization, the CDC, are all monitoring this system closely to see if this virus mutates into something more fearful.
Okay, and come back around. We will talk to you again in just a bit, Dr. McMahon. For now, we're going to turn things over to Jim Blue from Fox 55. Jim?